Exercise is fun, right? We know that physical exercise is important for maintaining physical fitness and can even contribute to maintaining a healthy weight, regulating the digestive system, building and even maintaining a healthy bone density, building up our muscle strength and joint mobility, promoting physiological well-being, reducing surgical risks, and even strengthening the immune system. Having said that, the question here is, does it even help our heart? Hello and welcome to MDTV Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you all from the world of medicine. Today I'm going to talk about how exercise benefits the cardiovascular health. Various previous studies indicate that exercising may increase the life expectancy of an individual and even improves the overall quality of life. While people who participate in moderate to high levels of physical exercise have a lower mortality rate when compared to individuals whose, by comparison, are not physically active. Regular physical activity had nearly doubled the cardiovascular benefit in individuals with depression or anxiety compared with individuals without these diagnoses. This is in accordance to a study that was recently presented at the American College of Cardiology's 71st annual scientific session. The rates of both depression and anxiety have risen during the COVID-19 pandemic and we all are aware of it. And the heart disease remains the leading cause of death. The study findings that I'm talking about underscore the important role of exercise in maintaining a healthy heart and thereby reducing stress. The research findings add to mounting evidence that exercise does improve the cardiovascular health by helping to activate the parts of the brain that counteract the stress. Overall, the study did find that people who achieved the recommended amount of physical activity per week were found to be 17% less likely to suffer a major adverse cardiovascular event than those who exercised less. These benefits were found to be significantly greater in those with anxiety or depression who had a 22% risk reduction versus a 10% risk reduction in those without either condition. In this study, the researchers first assessed the rates of major coronary events among patients who reported in a questionnaire format that they exercise at least 500 metabolic equivalent minutes per week, which is in alignment with the American College of Cardiology and the American Heart Association's primary prevention guidelines. These guidelines have a recommendation of at least 150 minutes of moderate intensity exercise per week with those who exercise less, and the metabolic equivalent minutes are a unit of exercise that represents the amount of energy expended during various activities. The analysis did reveal that people who got at least 500 metabolic equivalent minutes or more per week were 17% less likely to suffer an adverse cardiovascular event. Hence, it was concluded that any amount of exercise is definitely helpful, particularly for those who are suffering depression or anxiety on a daily basis. And not only will physical activity help them feel comfortable and better, but they will also be potentially reduce their risk for developing cardiovascular diseases. It can be hard to make the transition, but once achieved, physical activity allows those with these common stress-related psychiatric conditions to hit two birds with one stone. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.